Thanks for joining us on our live stream. Hidden cardiovascular risk factors. What am I talking about? You'll see if you stay tuned for this video. The whole cholesterol concept, is there a level of truth to it in cardiovascular disease? Of course there is, to a degree, no question. But what are the hidden factors that most of you have never even heard of, have never been tested for? Many of you have a huge family history and you're completely unaware. Stay tuned. Hidden cardiovascular risk factors. It'll open your eyes. I think it'll just completely shed light on maybe your potential risk factors or a family member. You stay tuned and watch this. I'm sure you're going to be blessed by it. Stay with us. Thanks for joining another edition of the live stream with Joe DiMatteo. Hope you've tuned into the radio broadcast. If not, you can, if you haven't found us through the website, you found us on YouTube, askjoedimatteo.com. You'll see where we do some radio broadcasting, Pittsburgh, Boston. We do XM Sirius satellite radio. We've got plenty of these live streams. If you're already on our site, tell someone about us, maybe a health condition that they're battling. Hidden cardiovascular risk factors. That's what I want to talk about today. So what do I mean by hidden? Well, we know that there are cardiovascular risk, heart risk factors, and the traditional ones that we're constantly aware of are things like total cholesterol, HDL, LDL, triglycerides, okay? Those are the typical traditional medical approaches that deal with what we would call overt cardiovascular risk factors. You might have these. You might be seeing a cardiologist. Maybe you've had bypasses. Maybe you've had stents. Maybe you've had numerous of these components. And so your physician typically is going to be managing not the hidden. These to me are, quote, termed more of the overt. These guys are not hidden. They're overt. But there are many that are experiencing recurrent cardiovascular attacks, strokes, atherosclerosis, peripheral artery disease, atherosclerosis to the vascular beds, to the extremities, and they're experiencing problems and they're already on lipid-lowering, cholesterol-modifying drugs. They've been increased in dose many times, oftentimes. And the real reality of it is that the literature shows us that up to 50% of individuals that have had a heart attack do not have one of the overt factors, which is elevated total, low HDL, very high LDL, or bad triglycerides with and usually a lot of times a combination of these two. This one being low, this one being high, puts you at a higher risk for cardiovascular risk. These are the overt. These are the black and white. These are the ones that most medical doctors are working with. And unfortunately, there are many folks, excuse me, that are still experiencing all of what I said: peripheral artery, stroke, cardiovascular disease, stents, restenosis of stents. It's a huge problem. So today, I'm not going to do a complete overview of this, but we're going to try to hit the high points. And because there are other factors like hormones and testosterone, especially in guys and some, but we're going to hit kind of the hidden factors that are not seen. In our local office here in Oakmont, and we will be trying to work to expand this more on a broad basis. So I don't know when you're going to be listening to this video. I probably shouldn't say this, but eventually we want to be working more on a national level, which is our goal, to have this laboratory testing done for you, those of you that are outside the tri-state area, the western Pennsylvania, the Ohio, northern West Virginia area, and Maryland, where many folks will come here and have these labs done. True Health Labs is what we're after here. Hidden risk factors. So let's get into them. Well, we know the basic ones. We cover them. ApoA1, HDLPs, the HDL. Now, what I don't want to do here is get too specific and kind of bore you. Here is the idea of the message that I want to send to you today. And I'm going to give you some background on these. These are a few of them. I've got more. ApoAs, what do? They help to clear up. They put it to you this way. They help to reduce cholesterol's ability to adhere to a wall, and they can clean up that which is already there. If you have very low levels, of ApoA1, you have a problem. All right. HDLP is a very specific. So notice, you say, wait a minute, I thought you said HDLs in the overt risk. Yeah, These are more specific. These are measuring the specific particles within the HDL component. It is measuring the specific particles or particle sizes within LDLs. You say, wait a minute, so if they just lower my number, isn't that a good thing? Not necessarily. There are many folks that are lowering the overt numbers, but they still have a very distorted, perspective on their HDLs and LDLs. They could still have elevated ApoAs. They could have small, dense LDLs. You say, wait, this is way over my head. No, it's not. No. Just hold on. And I'm telling you that if we can begin to modify, and I'll list you a few more in a moment, if we can know what these numbers are, and we can help you modify them through diet, through physical activity, through nutrients and so on, in some cases even medication, and make those recommendations to a physician, you can dramatically reduce your risk. Hidden cardiovascular risk factors. So let's move on. HDL2, this guy right here. It's the number of good particles. It's the percentage of good, the fluffy, the light particles, the good particles that clear up the bad cholesterol. It actually acts as an antioxidant. This is not just a total HDL. When you go to the doctor and they take your blood work and you see all the commercials, hey, I'm down with, the medication, so like I'm down with, a play on a younger generation, I'm down with whatever the medication is to lower my statins. What are they measuring? Then what are they reducing? That total value. We're saying you could even lower it, but you could have a bad distribution of HDLs, a bad distribution of LDLs. Actually, some drugs raise LP(a), so actually you're not really minimizing and reducing your risk of cardiovascular disease. Had a fellow we worked with just recently, cholesterol was really not all that high, had stents put in about 7-8 years ago, had another heart attack, had to go have more stents put in just recently, and the reality of it is his cholesterol was really never that high. I think it was 210 for his total. His HDLs were 50s. His LDLs were in the 120s, maybe a little higher than they should be. His triglycerides weren't too bad, but he's had now, I think, 4 stents put in 7 years. Now, you would think that his cholesterol, his LDL would be 170 and his HDL would be 32. He's not. Why is he continuing to reach the dose? Why is he reclogging these arteries? Hidden cardiovascular risk factors. These are pretty detailed, but we're getting into some of this. LDL-P, that's bad. That's really bad LDL cholesterol. I thought all LDL was bad. No, not all LDL was bad. Honestly, God didn't give you a component to make this LDL. It forms a structural purpose in the body, which I don't want to get into. But if you have a bad distribution of the light and fluffy and these P particles and the dense particles, it is more atherogenic even when you have lowered it. Next. Small dense, SD. This means even if you have an LDL of 100, if your proportion of these guys, the small dense ones, is very, very high in relationship to the light fluffy ones, you're still at a high risk, even though you've lowered it to a cardiovascular profile saying you should be at 100 and below, or if you're a diabetic, you should be at 70 and below to reduce your heart risk. The reality of it is I could lower those numbers, but if I have a wrong distribution, again, you could be thinking this is way too complicated, it's over my head. No, it's not. I don't need you to know all the details about this. I really don't. What I just need you to do is to have an awareness that there are other factors. I don't want you to be in the dark, to be going to get blood work, get your labs done, and they say you lowered your total cholesterol by 35 points, you are good to go. I'm down with whatever the medication is. The reality of it is you still are a high risk, possibly, if you have these other factors. Now, you don't have to go get these individually. There are labs, specific labs, that do all this as one battery of tests. that we will be probably releasing to you at a later point in time on one of these live streams. LP little a. This guy here is so bad. This LP little a, lipoprotein A, really, really bad. If this thing is elevated, if this number is elevated, by the way, some statins actually increase this, ironically. If your LP little a is elevated, you could have perfectly normal all your other cholesterol factors, and LP little a puts you at a 40% increased risk for cardiovascular issues when that number alone is elevated, LP little a. Let's move on to inflammation. Does any of your labs that you currently do measure inflammation? It does not. So quickly, myeloperoxidases. I can't get into the detail of this. LP platelet 2, HSCRP, and fibrinogen. Now, obviously, many of you are going to need some help. You say, look, I watched this video. I don't know what to do. I don't even know what he's talking about. I don't know how to explain it without putting these values down. I can't give you some crazy name and say, well, you just need to do this and follow me. No, and drink the Kool-Aid. No. I mean, if I give you these, you can Google some of this stuff, if you will, in some of these labs. So at least want to put them down and know that if you're a heart patient or if you have a family history, grandparents, siblings, and you've had a continual cardiovascular, and you might be seeing a physician, you might be on medication to lower your cholesterol, and your family is still having problems, you've got to look beyond that to those distribution of LDL, HDLs. You've got to look at inflammation. These are markers, and there are others. I'm just putting down the 4 that this specific lab does. High inflammation will increase your cardiovascular risk, and then we'll talk about genes. So inflammation. No doubt, this guy right here increases your clot risk. This one right here and this one, HSCRP and MPO, myeloperoxidases, if they're elevated, if these guys are elevated, they increase damage to the vascular wall. So does this. This one, if it's elevated, can increase your risk of stroke by up to 40%. So my cholesterol could be normal. I could have high HSCRP. I could have elevated fibrinogen. I could have another inflammatory marker high, and that is predisposing you at a high level. And here you've been told, hey, you're down with this medication, you're good to go. And the reality of it is, I'm not so sure that's the case. The last 2 areas I want to talk to you a little bit about are the genetics. I'll just write down at least one of them. How are we doing on time there, Joe? 12, okay. Let me just do these. I have more, but I'm not going to have time to do them all. MTHFR, Leiden factor 5. If you have this ApoE4 characteristic, it's how the body responds to, in essence, fat. It's a genetic component. So if you have elevated levels of this, that means if I have that and you don't, that means when I consume fats, bad fats, I have a much more violent oxidative response in my body than you do. I've got a bad disposition to it. The bad fat will affect me more. Well, I thought bad fats affect everybody. Yes, they do. But if you've got some genetic characteristics, it'll affect some of you worse than others. You could have an MTHFR problem. I know I spelled that wrong. MTHFR. MTHFR is methylene tetrahydrofolate reductase. Well, all that really means, it basically is, it's how the body responds. You make a protein that's involved in folate metabolism. All that really means is some of us have a genetic characteristic. If I have this, that I need more folic acid, I need more folate. If I don't process it well, I could be at an increased risk for neurologic complications, mood disorders, depression. If I have the other side of the generic tendency and characteristic, it's more circulatory, cardiovascular, clots, atherosclerosis, MTHFR. Now, is it just one of these things alone? I don't know. But if you have this, ApoE, if you have ApoE gene, an MTHFR, and let's just say an elevated LP(a), hidden risk factors, put check marks. Let's just say, because this is more Leiden factor 5 is more clotting. Let's just say these three things. And your cholesterol is perfect, 180. Your LDLs are 92. Your HDLs are good. And everybody's saying, hey, this is good. Doc's saying this is good. The reality of it is you could still be at a high risk. I didn't even talk about homocysteine yet. But you could be at a high risk if I've got boom, 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 that alone. You're still a high risk category. Does this make sense? Hidden cardiovascular risk factors, not spoken of, not talked about. The last area quickly, and we're out of time, the big one for me as well is insulin resistance. And those of you that know me and that have watched these previous videos or listened to the radio broadcast know I talk about this all the time. This is a huge problem. Insulin resistance, how would you define it? Insulin levels, pro-insulin levels. There's blood work that'll assess this. Leptin levels, and there's a few other things. But those are the HMOA levels. But these are the main factors that if you are elevated in your fasting insulin, okay, or leptin levels, etc., you move into the category of IR, insulin resistance, which puts you at a significantly increased risk for cardiovascular issues. Let me just see if there's anything that I've missed. There are some things that I couldn't even get to today. C-peptide levels. C-peptide levels. If C-peptide levels are elevated, depending on what your fasting insulin is, that could show that you would be put at a higher risk for heart disease and even diabetes. You're moving towards diabetes. You say, well, if I'm moving towards those things, then why do I even want to get these labs? For many of us, we need to see these characteristics. I just typed them up in black and white. Often when you see them on a chart and they take on a deeper connotation and a deeper meaning for you. When you see that, well, if it's in this range, it's good. If it's in this range, it's borderline. If it's in this range, this puts you at a high risk. So I'm going to hope by you even taking time to watch this video, one of our follow-up videos will be not just hidden cardiovascular risk factors, but what you can do about it. That'll be the next video. What are the applications? This is telling you what is the problem, what's behind the scenes, lurking behind the curtain. If I have good cholesterol, why would I worry? I hope I've explained that. You should still worry even if you have good cholesterol. God bless you. Thanks for being with us. There'll be a part 2 to this and maybe even a part 3, hidden cardiovascular risk factors. More to come. God bless. Thanks for being with us. See you next time.